Hi nurses. Tired this morning. I just worked a 16-hour shift yesterday, but I wanted to talk about a case of a patient missing dialysis for a couple of days, and the potassium creeped way up to 6.3, and the patient was really septic, so they had pneumonia, and that caused infection, and so their lactic acid was really high, like 12. And between those two things, the body becomes really acidotic. And when your body is acidotic, all of your blood vessels get vasodilated, they get kind of leaky, and they can no longer hold that blood inside the blood vessels the way they could before and stimulate those baroreceptors inside the blood vessels, so the blood pressure can't be maintained. So we had a few things going on. We had renal failure, so no urine coming out, a continually climbing potassium, a continually climbing lactic acid, respiratory distress because of the pneumonia, and because the body is trying to get rid of the acidosis, the metabolic acidosis. So you have rapid breathing and altered mental status. So lots of things going on there. So the patient ended up with a ventilator support, and they had to set the rate really high because the patient was breathing really fast, and we were also trying to blow off some of that carbon dioxide to offset the acidosis. So treatment, well, we sedated the patient because they were altered and to protect their airway, so they wouldn't pull their airway out. We maintained their airway in the ventilator settings and checked blood gases periodically to see how the acidosis was going. We gave treatment for the high potassium, which could be in the form of K-exalate, could be in the form of giving 10 units of regular insulin IV, followed by a D50 because of the drop in blood sugar that would happen. Those are all some ways that we would combat the potassium so that we didn't have any cardiac events. And then we also gave bicarb, so I gave 2 or 3 amps of bicarb, followed by a bicarb drip, and again, that's just to buffer that acid to try to prevent the severe vasodilation that was occurring. So because the patient was vasodilating so badly, their blood pressure was really low, so like in 60s over 40s, and so we had to hang Levophed, norepinephrine, which is a potent vasoconstrictor. So you take these really vasodilated vessels and you give them a vasoconstrictor. They're still going to be kind of leaky and want to vasodilate, but we're going to try to counteract that with a vasoconstrictor. So we ended up maxed on Levophed, which is 47 micrograms per minute. Well, the blood pressure was still 70s over 40s, and so we're still giving more bicarb and trying to get dialysis set up so that we can get that potassium down and buffer that acidosis. So the next drug that we hung was vasopressin, which we hang at a 0.03 mics per kilo per minute. And that's another vasoconstrictor, and so that also really helps to bring that blood pressure up. So here now we have 2 drips. We've got bicarb drip as well, and the Levophed and the vasopressin. We are trying to combat the potassium and the lactic acid. We're supporting the airway. We're sedating the patient to try to keep them calm. And then instead of hanging a 3rd drip right away, we hung a fluid bolus. So something with sepsis is that because those blood vessels are so vasodilated, you also want to make sure that you're giving them lots of fluid. So we also gave a 1 liter fluid bolus. And the blood pressure finally was in the 90s over 50s when I was ending my shift. And so the patient was also starting to get dialysis. Now the dialysis, of course, is also a problem because when you pull that fluid off to do the dialysis, your blood pressure can drop as well because of the fluid volume drop that you have all of a sudden. And so we maintain the drips at their maximum, the Levophed at the maximum, the vasopressin at the set rate of 0.03, and and ran the dialysis. And when I left, the patient was doing pretty well, under the circumstances. And this was all caused by, 1, they have pneumonia, but 2, they also missed a couple of days of dialysis. And whatever goes in stays in, and you can't get rid of any toxins or byproducts of metabolism. And so you can have a real real life-threatening problems from missing dialysis. So that's kind of my talk today, and I hope you get something out of it. Let me know if there's something else that you'd like me to talk about, and I'll just keep bringing these cases that I see or take care of when I'm at the hospital. And please go over to my YouTube, like, share, and subscribe. I've got 705 subscribers, and I'm trying to get to 1,000, and I would really appreciate your help. Thanks a lot. Bye.